Hello friends, this is a case of topical phacoemulsification in a grade 3 nuclear sclerosis cataract, and we intend to implant a toric lens in this case. So the intraoperative markings are to be done for the main incision and the desired axis. The reference marking of 0 and 180 degrees are made preoperatively at the slit line. So after the markings are complete, two side ports are made with 20 gauge MBR, little bit of intracameral lignocaine to aid in the topical anesthesia. Main port is being made with 2.8 millimeter keratome. Entry capsule stained with 0.6% trypan blue dye under air. And after the staining process, chamber is reformed with 2% HPMC. A 5 millimeter continuous curvilinear capsular axis is being done with the help of Utrata forceps. Multi-quadrant hydrodissection is done. Then we inject some Hylucoat, and underneath that we inject some 2% HPMC. So that is the modified soft gel technique of Arsenov to protect the endothelium. Nucleus is rotated just to be sure that there is no posterior corticocapsular adhesion. The Phaco is fairly regular process. Here we are doing vertical chop to fragment the nucleus into multiple pieces. And after the chopping is complete, we proceed to quadrant removal mode and remove the loose pieces of the nucleus. There is a little bit of posterior plate present there. So in these kind of cases, it is always better to remove the endonucleus first, because after the endonucleus has been removed, the pieces become fairly easy to emulsify and remove. This is the endonucleus being removed, and now we can see the loose pieces are coming very easily to the Phaco tip. This is the intact posterior plate, so we emulsify at the center and then again proceed to remove the loose pieces. The Phaco has to be conducted at a safe mid-pupillary zone and in a supracapsular or iris plane. So now the nucleus has been totally phacoemulsified. We proceed to do the bimanual irrigation aspiration to remove the cortical remnants. A little bit of posterior capsular polishing is being done here. So this is a single piece hydrophobic acrylic Toric Iol. I prefer to implant the toric lenses under hydro only, because I don't have to bother for visco removal after the lens implant. And if there is any visco remnant in cases of toric IOL, then there is a chance of post-operative rotation of the toric lens. So now the lens has been implanted into the bag, and with the irrigation and aspiration cannula, we are rotating the IOL to its desired axis. The lens markings, we can see they have to be aligned with the corneal markings, and while doing that, we have to be sure that the Purkinje image 1 and 3 are superimposed. And before removing the irrigation, I prefer to hydrate the side port and then I removed the irrigation probe and then again I did the other wounds. So now the case is complete. Thank you very much.